Hello, we are G8. We are going to talk about cytokine storm. Have you ever heard of the term cytokine storm? It refers to an excessive and uncontrolled release of inflammatory cytokines, leading to widespread inflammation and severe tissue damage. To understand this phenomenon, it's important to first grasp the role of cytokines in the immune system. So, what are cytokines? Cytokines are signaling proteins produced by immune cells and other cells, playing a key role in regulating immune responses. Their functions vary depending on the type, but the main roles include: first, recruiting immune cells, attracting immune cells to sites of infection or injury. Second, amplifying immune responses, activating other immune cells to strengthen defense mechanisms. Third, regulating inflammation, eliminating threats while minimizing damage to healthy tissue. Last, promoting tissue repair, supporting recovery after the immune response subsides. Key cytokines in a cytokine storm. During a cytokine storm, certain cytokines are particularly involved in driving the excessive immune response. First, TNF-alpha, tumor necrosis factor alpha. It initiates and promotes inflammation, and it also increases vascular permeability and induces cell death. Second, IL-6, interleukin-6. It plays a central role in acute inflammation. It stimulates the production of acute phase proteins in the liver and contributes to chronic inflammation. Third, IL-1 beta, interleukin-1 beta. It amplifies the inflammation response, and it also triggers fever and activates immune cells. When these cytokines are overproduced, they trigger systemic inflammation, leading to increased vascular permeability, coagulation disorders, and multi-organ failure. Diseases associated with cytokine storms. Cytokine storms are observed in various diseases. First, excessive immune responses to infections. COVID-19. In severe cases, abnormal increases in cytokines can cause respiratory failure and multi-organ dysfunction. Influenza A can lead to acute respiratory distress syndrome. Second, autoimmune diseases. Macrophage activation syndrome and adult-onset Still's disease occurs. Third, genetic or immune disorders. Hemophagocytic lymphohistiocytosis occurs. Cytokine storms require prompt treatment. Common approaches include corticosteroids to suppress systemic inflammation, IL-6 inhibitors to block IL-6 activity, JAK inhibitors to disrupt cytokine signaling pathways. Early diagnosis and the intervention are crucial for improving outcomes. Thank you for listening.